Hello dear students, we will discuss one of the post-operative status or complication. Let's see it is what this post-operative status is. This patient has undergone open appendectomy for burst suppurative appendicitis with sepsis. This is the McBurn incision, lengthy incision which is extended as a Rutherford margin by cutting the muscle upward and laterally. Let's see, there is infected area here, discharge is there. What type of, it's an host open appendectomy surgical site infection. So surgical site infection is different types: superficial SSI, deep SSI, organ specific SSI, organ space SSI. So this is the superficial type. So you should know the different classification. Surgical site infection is a short note for you. Many MCQs can be asked, and oxy also they will ask. So you should know. Second most common complication after surgery: virulent bacteria, altered wound, microenvironment, change the host defense. All these are the common causes. Common sources are warts, wounds, ulcers, catheter drain, all these things. Remember, sources are maybe endogenous or exogenous classified. Remember surgical wound classification: clean, contaminated, dirty. That's also important. PIRO classification is the common classification used in the surgical site infection: predisposition, insult, response, organ dysfunction, maybe clinical and molecular. See PIRO classification detail. There is a table in my book manual. You can go through that. It may be asked as a short note, and neat MCQ they will ask. So go through my manual book in the infection topic, surgical site infection. PIRO classification is there. There are so many other classifications. This is the one which is standard, which is commonly asked and used. So remember PIRO classification, details of which you can always go through it, which is important. And remember prevention of SSC, pre-operative. Remember preventive antibiotic, enhanced host defense. Remember management of SSC, pus culture, imaging technique, and blood analysis, blood culture maybe if required in severe cases, and antibiotic coverage, proper antibiotic, ideal antibiotic coverage, then regular dressing and eventual follow-up. Sometimes wound exploration and clearing all infected tissues, delay and later secondary suturing. All those things are the required treatment as an individual case to case basis. That's the important thing. So answer the MCQ. Antibiotics choice in tetanus are gentamicin and metronidazole, cefotaxime and metronidazole, amikacin and metronidazole, penicillin and metronidazole. Find out the right answer, put it in the comment box. Commonest group of lymph nodes involved by tuberculosis is cervical, axillary, retroperitoneal, Find out and put it in the comment box, students. I'll get you the right answer later. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method, including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics, including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery. Entire thing clinical method with a lot of photos, illustration, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail. Principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics: general surgery, endocrine surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and coming consultant also, with the illustrations, photos, a few video lectures and A lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic. So each chapter it is there. Covers everything for UGs, PGs, CBME, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast, and other things, include briefly gynecology surgeries, with step-by-step illustration photos. More than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries. It is there. You can always go through that in detail. Explanations are there. My small atlas of tissue approximation with the videos shows clearly, with the principles, how to suture tissues. Dissection and tissue approximation. There are two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram, and so on. My DigiNow lectures to the JP publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topics, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, examination, clinical examination videos also. It covers 220 lectures, cover everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much. So hope I understood SSI very well. Thank you so much.